Hi friends, I am Dr. Pratap Snato. I have done the MD in Physics Medicine. In today's video, we will discuss about poisoning from phosphorus. Phosphorus is available in two varieties. One is white phosphorus or crystalline phosphorus, which is used for fertilizers, insecticides, rodenticide, incendiary bombs, smoke screen, etc., fireworks, and it's the most toxic form of phosphorus. Then one more form is red or amorphous phosphorus. It is usually found on the sides of matchsticks. If you see the difference between white and red phosphorus, white appears as white or yellowish in color. It is translucent, waxy cylinders, has a garlicky smell, taste garlicky, and it is luminous in the dark. When in the dark, it becomes glow. It can glow in the under fluorescence in the light. When it is exposed to air, it oxidizes, emits white fumes, which can ignite at just at 34 degrees centigrade. For this purpose, it is kept usually under water. It is used as a fertilizers, vermin killers, rodenticide, fireworks, gunpowder, etc. So it is a commonly easily available for fertilizer purpose, rodenticide, and commonly can be used for suicidal purposes. And it is highly toxic. Red phosphorus, on the other hand, it is reddish to brownish color. It is amorphous solid mass. It is odorless. It is tasteless. It is not luminous. It doesn't oxidize on coming to exposed to air, non-foaming or non-inflammable, and it is usually found on the matchsticks, and it is also non-toxic. Coming to action of phosphorus, it is a protoplasmic poison which removes the cell membrane, which affects the cellular oxidation. The metabolism of cell reduces, leading to necrobiosis, which is predominantly seen in the liver. So, uh, liver failure is commonly seen in case of phosphorus poisoning. Coming to signs and symptoms. So, signs and symptoms in case of fulminant poisoning, acute and chronic poisoning. Fulminant poisoning occurs when last dose of same poison is taken. This is seen in phosphorus when 1 gram or more is taken. The person usually die within 12 hours due to shock and cardiovascular collapse. If he survives even after 12 hours, he will be restless, delirious, maniacal before death. There may be thirst, severe nausea, vomiting, and retching may also occur. In acute cases, the person goes through three stages: first, second, and third stage. In the first stage, because of irritation effect, there is burning pain in throat and abdomen, thirst, nausea, vomiting, diarrhea, severe abdominal pain, followed by breath excreta which have garlic-like odor. Vomit may have luminous vomit, which feces, which are diagnostic of phosphorus. So if the vomit has a garlic odor, breath has garlic odor, and if vomit is luminous, it is most of the times for confirmed that the person may have consumed phosphorus. Skin contact with the phosphorus causes painful penetrating second to third degree burns. In the second stage, it is a symptom-free period lasting for 2 to 3 days. Then the person in third stage has systemic toxicity which occurs because of when the phosphorus is absorbed from the body. These symptoms include nausea, vomiting, diarrhea, hematemesis, liver tenderness, enlargement of the liver, jaundice, and pruritus. The hemorrhages may occur into skin mucosa and membranes and viscera because of rupture of vessels. There may be renal damage again because of hemorrhage and also necrosis of the tissues. If it reaches the central nervous system, it can cause convulsions, delirium, and coma. Death, the cause of death in most of the acute case of phosphorus poisoning is because of shock, hepatic failure, central nervous system damage, hematemesis, and renal insufficiency. So mainly, whichever the most vital organs it affects will be the cause of death. It may be because of shock, it may be because of hepatic failure, or it may be CNS damage or renal failure. Fetal dose of phosphorus is 60 to 120 milligrams. Fetal period is 2 to 8 days. Treatment: gastro lavage can be done with 1 to 5,000 solution of potassium permanganate, which oxidizes phosphorus into phosphoric acid and phosphate, which can be easily eliminated. Activated charcoal with gastro lavage absorbs the poisons. Gastro lavage can also be washed with 0.2% copper sulfate or 0.2 gram of copper sulfate, which coats the particles of phosphorus with the film of copper phosphide, which is relatively harmless. Then vitamin K, 20 mg IV is repeated doses to combat hyperprotective thermonemia. The bowl should be evacuated with magnesium sulfate, again to prevent the absorption of phosphorus. Bowls should be washed repeatedly at intervals of several days so that any remaining phosphorus is removed. Oils and fats should be avoided, as they dissolve phosphorus and promote the absorption of any phosphorus which is present in the stomach or in the intestines. Transfusion of glucose, saline, and plasma with vitamins and iron is useful to protect the liver to correct the shock and dehydration. If renal failure is present, peritoneal or hemodialysis should be required. If there are burns on the skins, it should be washed with 1% copper sulfate solution in water for healing purpose. Coming to postmortem appearance, the person if dies because of phosphorus, there are no obvious changes in case of fulminant poison since the person dies immediately. The most of the signs of for cases of phosphorus when we look if in acute cases, esophagus, stomach, intestine show signs of irritation that is with luminous material may be found in the stomach. Gastric intestine contents may show it may have smell of alkalic with which may be luminous. The mucous membrane of the stomach intestines are yellowish or grayish white in color and are softened, thickened, inflamed, and corroded or destroyed in particles. Multiple smaller or large hemorrhages are seen. So, which I have mentioned, hemorrhages are mainly because rupture of blood vessels or skin, it may be seen in skin, subcutaneous tissue, muscles, serosal mucosal membranes of gastrointestinal, respiratory tract, under endocardium, pericardium, epicardium, peritoneum, in lungs, brain, hepatomeninges, and uterus. So, any way on any membrane on the any organs there may be hemorrhages or particular small hemorrhages or larger hemorrhages may be seen. Liver becomes swollen, yellow, soft, flabby, which can be easily ruptured. Small hemorrhages may be seen on the surface and in the substrate of liver. In persons who survive for a week or longer, the appearance of acute yellow atrophy are present. Kidneys are large, greasy yellow and show hemorrhages on the surface. The heart is flabby, pale and show fatty degeneration. Fat amla may be found in the pulmonary arterioles and capillaries. The blood may appear tarry and its coagulability will be diminished. Coming to chronic poisoning of phosphorus, the chronic poisoning usually causes a condition called as phossy jaw, which is a condition in which there is osteomyelitis of jaw with multiple sinuses discharging foul-smelling pus. So usually the lower or upper jaw, if any caries is present, it occurs because of frequent inhalation of fumes over a period of year causes necrosis of lower jaw in the regions of decayed tooth. So the vapors get deposited in the phosphorus and there is necrosis of the lower upper jaw leading to phossy jaw. At first there is a toothache which is followed by swelling and jaw, loosening of the teeth, necrosis gum and sequestration of bone in the mandible. Other systemic symptoms of chronic poisoning of phosphorus include nausea, vomiting, anorexia, pain in stomach, indigestion, purging, pain in the joints, loss of weight, bronchitis, jaundice, and anemia, which are all generalized symptoms which doesn't pinpoint this specifically for phosphorus. Coming to medical importance, that is circumstances of poisoning. Accidental poisoning is the commonest since it is easily available. Children may consume the phosphorus due to chewing of the fireworks or by eating the rat paste. Phosphorus also is can be used as a homicidal poison, which is mixed with alcohol or coffee. Since it has some advantages like there is a delay in appearance of symptoms that occurs after a few days after consumption of phosphorus. So there is no reason to doubt when the person doesn't have the history of consumption of that is doubtful meal. Symptoms resembles acute liver disease. Poison is oxidized in the body if the person survives for longer duration. So it will not be available. It cannot be detected in any toxicological screen. So phosphorus can be used for homicidal purposes. Sometimes it is taken by mouth and introduced to vagina to cause abortion. Cases of poisoning may occur during war due to phosphorus entering the body with fragments of hand grenades, bombs, bullets, etc. For arson purposes, to damage the property of any person in villages, white phosphorus is covered with dung or wet cloth and is thrown on the huts and the person escapes. When in the daylight, the covering becomes dry, the roof, since the white phosphorus is very much flammable and easily within 34 degrees centigrade only it gets flame. So once the wet dung gets dried up or wet cloth becomes dried up, it easily catches fire and it may ignite the hut, leading to damage to the property. These are my references.